Hello, good evening, good day, good morning, wherever you are in the world. Welcome to the Black Belt Academy of Surgical Skills. My name is David O'Regan. I'm a cardiac surgeon in Yorkshire in the United Kingdom, and I'm the director of the Faculty of Surgical Trainers for the Royal College of Surgeons of Edinburgh. And yes, I am second Dan Shotogan Karate. This evening, we want to talk about posture, but also in developing this idea, would like to share with you my philosophy on teaching and training as derived from our observations of other sports. In 2015, I published a paper with a colleague called From Golfer to Airline Pilot, because what I thought was remarkable was the whole setup and process in golfing. Firstly, and you'll recognize many of these points is pertinent to the previous series and will emphasize again in the new year. Holding the golf club is like holding an empty tube of toothpaste. There's a lightness of touch. And the grip is extremely awkward, but it's deliberate. Once you're holding it properly, grip, address, feet apart, shoulder width. Now you've got to put your bottom out, keep your head up, and allow your arms to drop to the floor, such the club is sitting on the floor, and align the ball in the sweet spot of the club. The whole action of golf now is to clear your head. And most pros will tell you is if you're thinking of something else, you're not going to do it properly. It is not hitting the ball hard, but using the correct technique, which is well recognized and described by all golf pros. To take the club back to 90 degrees, and there's a cock in the wrist at 90 degrees, the shoulders are rotated underneath the chin, and it comes back down through to hit the ball. Weight is transferred to the left leg. You're still looking at the ball, and the club is taken through. It sounds easy, but it's not. And 80% of golf is actually the setup and the address. I've been running a cardiac basic skills course for 20 years and deliberately call it power excellence and massage the metaphor on different levels all the way through. And the first level is posture, address, relax. We don't attend to posture in surgery, and we don't describe the address. And certainly, when you're learning, it doesn't feel very relaxing at all. Indeed, you can barely breathe. Now, I haven't pursued golf because it takes quite a long time. And I recently took up, and you met my son last week as my assistant, I took up martial arts. But my other hobby is Iaido, the art of drawing the sword. And this art is described in a text written in 1643 by Miyamoto Musashi, and is very deliberate in the description and use. As I stand here, the heel of the sword should be at the level of my umbilicus, and my flexus pollicis longus, which happens to be, as I previously mentioned, one of the most powerful muscles in the forearm, is sitting over the suba such that nobody can pull the sword out and use it against me. But the art of drawing the sword is a two-hand process. And that whole movement should actually occur in one breath or a couple of heartbeats. The sword is held at a level of the umbilicus with a point up. Should your adversary advance towards you, they will actually walk onto the point and will strike the throat. At the end of the slice, there's blood on the sword, which we have to get rid of with a shibari, with drawing the sword out to the side and shaking off the blood. Putting the sword back in the sheath, you're wiping blood off with your forefinger and thumb, and you pull your sheath back on to the sword. These steps are described and are deliberate. And what I like about the text written by Miyamoto Musashi, there are rules for learning the art. Think of what is right and true. Practice and cultivate the science. Become acquainted with the arts. Know the principles of the craft. Understand the harm and benefit in everything. Learn to see everything accurately. Become aware of what is not obvious, and be careful even in small matters. And do not do anything useless. Does this not describe surgery? But what it also describes at the beginning of this chapter is rhythm is something that exists in everything. But rhythms of martial arts in particular are difficult to master without practice. And I would say the same applies to surgery. And the natural rhythms that are applied are your own breathing and your own heart rate. And that is why drawing of the sword is described as being one with the sword. And the adjective used is serenity. So it's interesting that these two sports, golf, martial arts, the Ido, are well described and need a clear head and mind. What is interesting in martial arts as well is that the very first strike that you learn, or izuki, is a strike to your solar plexus, or soigetsu, with your hand. Your shoulders and your hips are supposed to be aligned and facing forward. Your feet are facing forward, and there's a 45-degree angle between your big toes. Your front leg is bent such that the knee covers all but the tip of the toes. And your back leg is locked out, such that you cannot be knocked back. The reverse is true in Gyakuzuki, where your shoulders, elbow, and fist should be aligned, and the power is generated through the twist of the hips. Those are very basic moves that you need to practice and practice and practice again. And even at second dan, you're doing them 60 to 70 times when you're physically and mentally exhausted. But what about surgery? That's physical, mentally exhausted. But nobody in my 15 years of training, apart from one eccentric individual, addressed posture. Mr. Christopher Lincoln pointed out my poor posture during an operation. We were both sterile, and he took a sterile bandage, and he bandaged me to a drip stand to ensure that I was upright and straight. And since we're in the festive season, I wondered whether we should try this. Essentially, from the top of the head, there, through the ear, oh, it's not going to stick, through the shoulder, through the hip, and through the knee, should be a perfect straight line. That the shoulders are relaxed, the cervical and lumbar lordosis are preserved, the chin is horizontal with the ground. Might be better demonstrated, rather than the Christmas decorations, just using a golf club. holding it in my hand. And I'm not saying my posture is very good, and this is after 20 years of surgery. But I've also had fusion of 5/6 of the cervical vertebrae, and I suppose I can say I know I've got my head screwed on. People will question whether that's right or not. But what happens in surgery, we're often leaning forward. And as we lean forward, we lose the cervical lordosis, chin protrudes, and the shoulders internally rotate. And what happens in that circumstance is that you're putting a lot of tension across your neck. The sternocleidomastoids are shortened, pectoralis muscles are shortened, and all your rhomboids and trapezius and infra and supraspinatus scapular muscles are also involved. But really what is quite striking, for every inch or 2.5 centimeters you leave this midline, your head gains 10 pounds. So by the time you're 8 centimeters forward, leaning over, your head, instead of being 4.5 kilograms, will effectively weigh 19 kilograms. And I've often thought, right, standing like that is a bit like a crane with your hamstrings and back and neck all over the top and your hands there. Whereas we should be standing up straight. A colleague did a study of cardiac surgeons in Manchester and found that most of us have had problems with the neck. But I read in a paper that 92% of plastic surgeons record having problems and aches and backs in the neck, but 83% of them had not had any instruction whatsoever on posture. And before we go into theatre and after we go into theatre, we should be stretching and warming up. I've always thought it'd be nice to have a physiotherapist to actually work on your shoulder and back muscles at the end, but that'd probably be asking too much. But what you can simply do is stand up against the wall, bring your shoulders back, bring your head back, bring your chin in to rebalance the muscles of the neck and the muscles in the front and the back. Walk forward a little bit and hold it there just to stretch. If this causes pain, or tingling or numbness, then you should desist and probably seek a physiotherapist or professional help. But nobody advises us on this. So what does it mean for surgery? Well, have you ever thought why kitchen countertops are the height they are? They're the height they are because that's the median height of the population to optimize the functional anatomy of the upper limb. And that is why I probably look like a surfer with this board. The Black Belt Academy encourages you to use an ironing board to operate. The simple reason is that you would not operate up here, because what happens then, your elbows come out to the side, your scapula are fixed, and you're leaning forward, adding to the strain and weight on your back. But this also limits the pronation, supination of the arm. Similarly, you would not consider operating down here, or certainly you would not consider ironing down here either, because of the obvious strain and hunching over of the neck and the back and the internal rotation of the shoulders. So why I recommend as a basic tool for all skills labs and for you to practice at home is very simply an ironing board. So I actually went for an ironing board that gave me a range of movement, such that I can stand at the table, my fingers gently resting on the surface, but you'll see that my shoulders are back and relaxed, my elbows are by their side, the elbows are slightly extended, and my wrists are palmar flexed. And this is the perfect position. And it translates usually to the top of the patient, depending on their body habitus, but being about the level of the anterior superior iliac spine. If the patient was on there, I could actually set that level. And this is a very functional, easy level. Now, the important thing to do now is to simply incline your head rather than lean over and stick your chin forward. It's interesting that even people who learn the piano or play an instrument, the first things they're taught is how to sit properly. A colleague who's an ENT surgeon in Bradford, who's a flautist in the orchestra, said he wouldn't dream of trying to blow his flute unless he is sitting properly. But we do not address these fundamentals in surgery at all. As I previously explained as well, is that your assistant needs to maximize the movement of their upper limb, and therefore it is appropriate that you're both on the level, not only physically, but I also feel that's part of respect as well, that you're on the level. Because what I think is fundamentally wrong with surgical training at the present moment is, this is a kibidashi stance in karate, is that the models are presented at a table such that your wrist and elbow at the same level. This is like learning to play golf sitting down, and what we usually do to sit down is eat. My colleagues who sit down are on stools that go up and down and round to give them that movement and direction. We don't point out this in surgery, but my concern also is that rhythm only comes through practice. And as I said, you can't play golf sitting down. You can't become a black belt unless you get the basic postures right. And it's interesting that first posture in karate is the fundamental for all further forms and all further katas. So I'll put it to you that your fundamental form is your posture and a correct table height to maximize the functional anatomy of your upper limb. Thank you very much for joining me for this series. We will be back on the 6th of January and we'll start again. You will now realize that having got the table right and your posture right, we're operating at depth. So your alignment and position of your needle to the tissues has to be adjusted accordingly. So it's a bit like the golf I described. Once you've got your grip, address, stance, and position, the alignment of the golf club to the ball will mean, without effort, perfect swing, and the ball will go in the direction intended. Having adopted this position in surgery, your alignment of the needle will dictate whether you stand on your right foot or you stand on your left foot, and also the angle is dictated because your wrist is now lower than the elbow. This will be explained in the next lesson on the 6th of January. I hope to see you then. I hope you enjoy the festive season. Please be safe, and I wish you well. Thank you for joining the Black Belt Academy, and see you in the new year. Good night, good day, good morning, good evening.